I think the number one thing that as more and more people become aware of myopia control and myopia management is not just relying on whatever you've been prescribed to help slow down the progression of myopia if you've already started it. And one of the analogies is a bit like being diagnosed with diabetes and needing medication for that. And then going, well, I don't need to change my diet. I don't need to change the amount of my exercise. The tablets are going to keep me healthy. That's not the best way to go. So leaning into some of these things that you as a family or as a child might have control over, which is spending plenty of time outdoors. So getting that sort of 90 minutes to 2 hours a day minimum of outdoor activity, minimizing or eliminating really unnecessary non-essential screen time, limiting that non-essential screen time to sort of 45 minutes to an hour lots, in my opinion, if you're separating it with a good 5 or 10 minute break where you're moving around ideally, and ideally in an outdoor environment during those kind of breaks.
Digital screens get much of the blame when we talk about deteriorating kids' eyesight. There's a lot of discussion about the effects of blue light from iPads in the classroom and phones at home. But in practice, the real issue often isn't what kids are looking at, it's how long and how close their eyes are working without a break. Today, I'm talking once again with Paul Graham, Principal Optometrist at Harmony Vision Care, to unpack how long periods of near work affect developing eyes, why myopia is increasing, and what parents and teachers can realistically do about it. But first, who am I? My name's Paul Salloway. I'm the owner of Opix Digital. We're an agency that helps eye care professionals to grow their practice and connect with their community. So, hi, Paul. Good to speak with you again.
Oh, hi. And, we Happy New Year and all of that as we enter into a fresh new year.
Indeed, yes. Yeah, Happy New Year. So I think back in December we had a discussion about how parents can maybe have a conversation with their children about not spending too much time on the screens over the break. And I actually did talk to a lady yesterday who said she had a heart-to-heart with her teenage daughter about that topic, and to her surprise, she actually listened and spent the Christmas holidays doing a lot of crocheting. So there must be music to your ears.
Yes, yes, yes. Those old hobbies are making a resurgence, which is nice.
Right. Okay. Well, before we kick off, I understand that you've been introducing red light therapy into your clinic there, and maybe you've got an interesting mascot you wanna share with us.
Yes, yes. So if you Eye Rising International, if you sign up, they have a mascot called Willow the Wombat that arrives with every device. So
Right.
it creates a bit of interest, particularly with some of the younger kids. So,
Very cute.
but for the value of this video, poor old Willow's looking a bit out of focus. There we go.
There he goes. All right. So parents do hear a lot about blue light from screens. So from a clinical perspective, what's actually happening when children spend long periods on their devices?
Yeah, look, I think it's a combination of things. I like to talk to parents around it being an opportunity cost. It's the time that they spend indoors on a screen is the time they're not spending doing healthier types of activities outdoors,
Yep.
or even indoor activities that are done further away. But the big one is, natural outdoor light and activities being the thing that they're missing out on.
Mm. So you think there's maybe a little bit of an over focus on the blue light effects, and it's more as you say, an opportunity cost situation.
Absolutely. And, myopia is obviously increasing, but it's not a new thing. And so before the advent of technology and devices, anyone who spent a large amount of time doing near work indoors, I mean, you think of a classic academic or accountant, they developed myopia. So it's only that, even non-academic people are now spending a lot of time doing near work for long hours indoors that we're starting to get this myopia epidemic. And I'm sure, in some countries too, it's the ability to get outside easily in big built environments. The cities is another aspect where Australia's kind of got a little bit more of that open space, but certainly with increasing sort of urbanisation and high density living, that starts to make it a bit more challenging.
So if a child was reading a book at the same distance from their eyes at the same length of time as they would spend with a digital device, are their eyes under similar kind of strain?
Yeah, look, that's one that we're still trying to tease out. How big does the screen size make a difference? Does the distance make a difference? I tend to sort of look at what are the things that are happening when you're doing a book. If you're reading a book and you're flipping pages, you're getting this kind of visual break in the activity. It's not capturing your attention the same way that a screen does.
Yeah.
Your mind might wander as you think about what you're reading, whereas the screen's really captured your attention. And if it's small, you tend to hold it closer.
Yeah. So, when I was growing up, and you're probably the same, we all know friends who are bookworms and enjoyed reading, but I think you're saying that like digital devices have a much greater capacity to capture your attention for longer periods.
Yeah, look, if you weren't an academic kid or a reader, you were outside.
Mm,
Whereas now, it doesn't matter what your interests are. A lot of the interests now are indoor screen based. So there's a lot more people, regardless of their abilities and interests, becoming myopic.
mm,
I have families here where, obviously family history plays a part, but we have families now where it's an absolute surprise to them that their kids are becoming
mm.
short sighted because there has been no family history prior.
So we are hearing more and more about myopia now compared to previous generations. So why do optometrists focus on myopia as a situation that is much more than just the case of, oh, well, you need to get a stronger prescription, you need to upgrade your glasses? Why do optometrists try to really have that conversation with parents around myopia now?
Yeah, well, there's two sides to the coin. Is that we've now got some strong evidence that we can really intervene and make a change and do things to help slow it down. So one, that creates a lot more interest and opportunity because we've got more tools at our disposal to help manage it rather than just correcting things.
Yeah.
But the second part is that the concern about the increase in the number of people becoming myopic or short-sighted is that they're also doing it at a younger age. If you start becoming myopic at a younger age, then you've got a lot more time to develop a greater degree of myopia. You also tend to progress more rapidly when you're young. And then the concern there is that the more myopic you become, there's some strong evidence around that's tied to an increased risk of certain serious eye diseases in an adult. And so the whole drive around myopia is to prevent people. It would be nice if we could stop myopia altogether, but the real thing is stopping them from becoming what we call high myopes. So that's over -5 and over sort of 26.5 millimeter of axial length, because that's what's linked to a much more serious risk of eye disease like glaucoma and retinal detachments. And if you go higher still, macular degeneration. So some of those sort of more serious eye diseases later on, that as a whole, we're trying to get less and less of the population reaching those kind of heights.
So is the science around those long-term effects, like, is it much stronger now than it was, say, a decade ago? Or do we understand a lot more about the long-term implications?
Yeah, look, and I think that's just been reinforced over the last decade,
Yeah.
and certainly it was starting to be pretty strong even a decade ago, but it's only got stronger since. And one of the strengths, and we talk about this a lot, is that sort of outdoor time. And with a lot of research, you've got to be careful around words like causality, association, relationship, and those sorts of things. And most research ends up showing a relationship or an association between one thing and another. To actually say that one causes the other, you need an enormous amount of research over time to really be able to say causality. And in myopia, we actually have the lack of outdoor time being a cause of earlier development of myopia. And so we've got a much stronger link there simply because of the volume of research that's being done now.
So it's that old correlation is not causality thing, isn't it?
Yeah. And that brings up the discussion around, is it outdoor time, is it intensive indoor time? And there is still some information that needs strengthening, but we've got some enough strong evidence. And just looking at the behaviour, you can make some fairly common sense decisions based on looking at the difference of, well, what do we do now compared to what we used to do 20 years ago? That the evidence kind of suggests is part of the whole mix of things that we're doing that results in more myopia in the population.
Well, I think that's a good segue to my next question. You mentioned about outdoor time being part of the answer here. So what does being outside actually do for young eyes? Why is it important?
Yeah, and you look at the mixture of the type of light and the wavelengths that are available when we're outside versus inside. You've got the sheer intensity or volume of light is so much greater outside compared to inside. There is an aspect to being outside that I don't think is talked about enough, because I think to try and research it becomes very complicated and difficult. But I often talk to patients about, what we don't encounter in an outdoor environment is the four walls. We've got walls and ceilings in our visual space where if we were outdoors, we'd have open space. We wouldn't have those things. there's an argument that maybe the retina, being a little bit of brain tissue that we point at things, actually is picking up and detecting that things are closer in general, and that may drive some sort of adaptation to, develop myopia, which is great vision for caves, but not good for much else. And so I think it's a combination of, a lack of movement through a natural space without walls, and the sheer volume and type of light that we're not getting when we're inside.
And last month we talked about how free time outdoors is also important for cognitive aspects,
Absolutely.
isn't it? So would you like to speak about that a little bit more?
Well, and that's the thing I think we need to look at with any sort of TV to some extent, but certainly when you get into games and devices and stuff, that world is created for you. It's highly visual. You're not creating the imagery in your own head. You're not using your own imagination, and those sorts of things are vital to good cognitive development. Is actually solving problems. The type of problems you solve in games might look quite complex, but they're still bound by the rules of the game and by the environment that they've been programmed in. There's nothing like making up your own rules and having your own interactions in a natural environment to kind of really get your brain to learn how to problem solve properly.
Yeah, I was thinking when I was thinking about this morning that we've probably heard the term helicopter parenting. In some countries, there's the phenomenon that they describe as being a tiger mom. I'm not sure if that's a derogatory term or not. I'm sorry if it is, but I think we know what we mean here. That like a lot of parents now sort of micromanage their kids' free time activities. So do you think that's maybe also having an effect here in terms of like the increase in myopia?
Maybe actually, I think the other way is actually putting it on the kids to manage themselves, and it's probably sort of energy in the wrong places. I have a lot of kids. I can't get him off the screen. It's like, well, the self regulation is not there when they're young, and it's very easy if you turn your back for them to lose a couple of hours on a device or indoor time. So I think it does need a little bit more of a concerted effort, and that discomfort of sort of saying, no, you need to turn the device off or limiting it within the household. So I think there are times when maybe that tiger needs to come out a bit more and a bit more targeted at the amount of screen use.
Right. You mentioned about light, and I've had some discussions recently with professionals about about poor light. So, for example, like reading in a dark room, for example, and I've always kind of wondered, is that apart from eye strain, which we probably assume is the case, but is there anything around reading in poor lighting conditions that might also increase the progression of myopia?
Yeah, look, that's a really interesting one, and I read an article recently where they were looking at people wearing myopia control, prescribed myopia controlled spectacles versus regular spectacles, and the lack of decent lighting while doing a near activity indoors may influence how effective those spectacles are. So it kind of is suggestive that if the lack of light might decrease the effectiveness of a myopia control lens, then that makes light fairly important, or the lack of it fairly important. So, I would certainly be leaning into, reading in dim light being a risky thing to do, particularly if it's done for many hours.
Okay, well, so if you're watching on YouTube and you're getting value from this discussion, then do us a big favor and hit the like button. It really does increase the chances that the YouTube algorithm will show this content to other people who might also benefit. Okay, so if we think about a balance of screen time between school and at home, so what are your thoughts on what is a realistic balance? So how do you think parents and teachers can sort of manage that?
I think the tricky one is trying to decide how necessary screen use is, and limiting or eliminating, trying to eliminate absolutely unnecessary screen use, where that's kind of just time wasting and time killing, and that would be the first thing to pick on. And then limiting unnecessary things. It's hard to avoid in the education environment sometimes, and obviously with work we're using devices and computers as part of that, and then limiting the amount of time in one hit. We often hear things like the 20-20-20 rule, which sounds cute, but I'm not sure of how practical it is to stop every 20 minutes and look 20 feet away for 20 seconds. I think a much more practical way, particularly for getting feeling like you've had some well spent time doing something, particularly if it's sort of work related, is that you go 45 to 60 minutes, then take a break, but make sure that break is a decent 5 or 10 minute break where you're getting up and moving around, preferably in a well-lit outdoor environment, would be the ideal that we would be going for. Some of the numbers we look at in terms of outdoor versus indoor time, you want sort of more than 90 minutes, let's say 2 hours of outdoor activity each day as a part of a myopia prevention strategy. And the opposite is true, that we've got to get the indoor unnecessary screen time and near work time under 2 hours as a broad kind of, very broad brush kind of approach. But I think we need to really look seriously at kind of going, okay, how much of this is really necessary, and trying to eliminate that out and find some other old school activities to do that are better for development and for your eyes.
So if you see your 16-year-old doom scrolling on social media, it might be time to step in and just have a word then.
Yeah, that's a contentious issue, because they seem a little lost without it at the moment. So I think it's one of those gentle things of finding other things to do and other ways to pass the time. And, I think our kids have lost the ability to be bored. I even catch myself doing it. Okay, I've got nothing to do at the moment. And your hand creeps out to the phone, and it's like, well, do I actually need to be filling in the time by the doom scrolling or not?
So are there any other sort of signs or signals, such as like eye rubbing or headaches? Could they also be indicators that kids are spending too much time on their screens?
Yeah, and sometimes they can be a bit tricky, because if they're getting a bit of a buzz or enjoyment out of the activity they're doing, they may not be aware of the discomfort until afterwards. And so looking for signs of eye rubbing could be an early one, because they might be rubbing their eyes without actually being conscious of it. It might be the complaint of the headache later on that you've blamed on not drinking enough water, when in fact it's been the 2 or 3 hours of gaming over here where it's kind of been an issue. There are usually more symptoms in activities afterwards that are more chore-like, having to do your homework and getting the headaches and sore eyes from during that, when they've just spent several hours doing something else and not complained. It's all cumulative in the end. And so, red eyes, eye rubbing, complaining of headaches. We don't tend to get so much the blurry vision, although that is possible. I know one of my kids, it was reading and asking if the lights could be turned out while she was reading, and I'm like, well, why is that? And she said, well, my eyes are hurting. And I'm like, well, let's have a talk about that, about why your eyes might be hurting, and turning the lights off. It might not be the brightness of the light that's the issue. And so light sensitivity can be another one of those sort of signs.
And so, eye rubbing could be something else as well, couldn't it? Like it could be allergies, and headaches could be dehydration. So
eye strain gets blamed on a lot of things, like allergies and dry eye and things like that, when it's actually it's eye strain that's actually created. Now, dry eye is a part of eye strain, but I think the other aspects of like focusing and eye teaming gets a bit overlooked for these, sort of easier to draw lines to between dry eye symptoms when it could be an eye strain kind of sort of situation.
All right. So then what age should children have their first eye examination, do you think?
For various reasons, so at different ages. So we recommend 6 months old is to make sure that everything's looking good as they begin life, ruling out some of the more rare but more serious eye turns that might occur at that age. Like I said, they're quite rare, but we just want to kind of get a good handle on how development's going. Our next age that we recommend is between 2 and 4, and again, a lot of that's around making sure that they've got good visual development from the point of view of lazy eyes and eye turns, although you can start to look for some of the things that might indicate there might be issues by the time they're hitting primary school. But I would certainly recommend a prep or kindergarten full assessment. They do screenings in schools, but the screenings only really are looking for a very small number of eye conditions that tend to be on the more extreme end. I think getting some baseline, a good sort of solid understanding of how this child's vision has developed, one, as a predictive tool of how they're going, it sets up the conversation around healthy visual habits, and it also means you've got some baseline. So if they come back in 2 years' time and you've got complaints, you can see and look back and go, oh, look, we didn't see any issues back here, something's changed, and that opens up a conversation around where it might have come from and the kind of management decisions you might like to make. So certainly, so that would, in summary, be 6 months old, around 3 years old, and the start of school would be the first points of call, and every 2 or 3 years after that, unless there's something you're actively monitoring.
And with myopia, I mean, the earlier that you can get on top of it, the
The
more
better,
effective it
yeah.
is,
And
isn't
so
it? Yeah.
I would adjust that recommendation to, if someone's in the family, or there are concerns around a risk of myopia development for that particular person, either through family history, or there's someone who just, they spend a lot of time indoors. I mean, there are populations of people out there where outdoor activity doesn't work for them. They may
Mhm.
have neurotypical development where their screens is their only outlet. So
Mm.
there are things that might be unavoidable. So you might want to monitor those people a little bit more carefully.
Mm. Okay. Well, so to wrap up, what key takeaway points would you like parents and educators to understand from this discussion if you were to give some practical tips?
Look, I think the number one thing that, as more and more people become aware of myopia control and myopia management, is not just relying on whatever you've been prescribed to help slow down the progression of myopia if you've already started it. And one of the analogies is a bit like being diagnosed with diabetes and needing medication for that, and then going, well, I don't need to change my diet, I don't need to change the amount of my exercise. The tablets are going to keep me healthy. That's not the best way to go. So leaning into some of these things that you as a family or as a child might have control over, which is spending plenty of time outdoors. So getting that sort of 90 minutes to 2 hours a day minimum of outdoor activity, minimizing or eliminating really unnecessary non-essential screen time, limiting that non-essential screen time to sort of 45 minute to an hour lots, in my opinion, if you're separating it with a good 5 or 10 minute break, where you're moving around ideally, and ideally in an outdoor environment during those kind of breaks. So the big one is that there's a lot that we can be doing from some behaviour management point of view to assist the prevention of the development of myopia, but also if you're already myopic, it's not just relying on those optical therapeutic strategies for holding things at bay.
All right. Well, Paul, thanks as always for a very clear and practical explanation of something that families, often worry about and don't fully understand. So, for parents and teachers who do want to get some personalized advice about children's vision or myopia risk, how can they get in touch with Harmony Vision Care?
So we've got harmonyvisioncare.com.au. So it's a way of actually, we've got plenty of resources and extra information on the site by itself. It's a way of contacting us through the links on the website. And you can also book appointments there if you're wanting to be assessed and you've got any concerns. And you can also call us on 0755205900. We've also got Facebook and Instagram, and obviously this YouTube channel where you can find our details from all the links below.
And once again, if you found this video helpful, then please hit the like button, subscribe to be notified whenever Paul releases more helpful videos like this one. Okay, well, thanks again, Paul, and thanks everyone for watching. See you next time.
Thank you.